The opening of Bayou Region Surgery Center took part of our surgery schedule out that was really a rapid, fast, quick turnover in short ENT cases, short orthopedic cases. So we could concentrate more on more of the complicated cases, if you will. We have a cardiovascular program here. We have neurosurgery that operates here. So we were trying to mix in all of these cases, not to mention our ambulatory care unit that can only handle so many cases in a day. That was being very difficult at the time.
So what it did for us was it did take away cases, and we were seeing more of the more difficult cases, the more complicated orthopedic cases. And so we had to, our turnaround time was increased a little bit at that time, so we definitely needed to be efficient and to make sure that we continued to maintain a low turnaround time for those cases. After the project, the physicians were very pleased, and the morale had increased a lot, and a lot of them decided that they would continue to stay and operate within our hospital because of the improvements we had made.
We negotiated a deal where we are 50% owner with 18 of them in a surgery center located on our campus. And in our immediate area, there aren't any other surgery centers. And what happened is about 5,000 cases went there. That continues to grow. It's been a very positive thing the surgery center has. It has been a good partnership with our doctors, and our overall goal, my goal, was to make this hospital a go-to place for surgery. I count all of that a big win.
Once we finished the OR project, our CEO said, let's do an ED project. So we did. We dove into an ED project, and we learned a lot from the OR project, so we brought a lot of the tools over. We knew we had to get staff involved, so we used a lot of the CAP tools to share a vision on what we wanted to accomplish. We established the same type of teams. There was a lot of simulation done. We were actually getting ready to build a new ER. We were 12-bed, and we were going to a 26-bed ER. So simulation was used a lot by GE. They ran it, and looking at sneaker time for the nursing staff, and positioning bathrooms, coffee pots in better places that they would not have to walk as much. So we also utilized Hospital of the Future of GE to help us to create our new ED. So we utilized that. Metrics, we established the same type of metrics like we did in OR with clear definitions, and those were a lot of the things that we brought over. So it was vital. We learned a lot from the OR project that we were able to use in the emergency room project.